Hello, Namaste. I welcome you all to the 49th session of Gurubodha. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupa. Along with Dr. M. B. Gururaja sir, we have Dr. Raghuram Shastri sir. Putting this question to Dr. Gururaja sir. If a patient is taking medicine for hypertension, does taking Triphala interfere with medication?
Definitely, we advise patient not to consume any Ayurvedic medicines while taking other medicines at simultaneously at both the medicines together. Means we need to give certain gap, maybe half an hour to 40 minutes gap if it is given and taken. Definitely, it won't cause any hindrance to any of the antihypertensive drugs which is already taken by the patient. So I don't think so there is any logic behind this, whether to consume this or not to consume it. There is no such issues to be bothered here. Definitely we can consume Triphala because it's a rasayana, its effect is entirely different and it won't come in the way of antihypertensive drugs. So it can be taken. But only thing is that to avoid any possible things which we don't know or which is not recorded anywhere in the medical, Ayurvedic classical text or even the latest researches, if it comes to things and many times the patient may be taking a variegated drugs, we don't know such type of collaboration or the drug-drug interaction might have taken place and such studies are not available. It is better to avoid them, to physically mixturing them before taking or maybe taking with very close interface. It is better to give a gap of 40 minutes or 30 minutes, that will be fine. You can take it, no issues with that.
We have been discussing that if somebody is taking allopathic medicine and Ayurvedic together, then better to give 30 to 40 minutes gap. So another question was that is our cardamom Ushna or Shita? So sharing the Nigantu references here. Kayadeva Nigantu says Suchmaila Mutra Kruchashraha Shwasa Kasa Kafapaha. There is Suchmaila Shitala is explained by Dhanvantari Nigantu. Ela Sukshma Kafa Shwasa Kasa. So it is again Bhava Prakasha mentions it as Shita. But then again, it is useful in kapha disorders such as Shwasa, Kasa, Arsha, etc. So can you please decipher this tangle, sir?
See, very clear. Ela as well as Lavanga, both are Shita in its Virya, but their rasa is Katu. Here, the drug action of Kafahara, Shvasahara, Kasahara, and those things are attributed to its Katu rasa, not because of its Shita guna. When Katrasa is playing that role of Kasahara, or Shvasahara, or even Kafahara, the Shita guna or the Shita Virya won't come in the way. So it's very clear, both Ela as well as Lavanga, both are accepted in the classical text and even Nigantus very clearly, they are Shita in Virya. But their action, because we already discussed in the earlier classes also in many of the occasions, a drug action may not be just because of its Virya. The drug action may be because of rasa, it may be because of vipaka, virya, and even for the plenty of things will take place. And there is a drug-drug interaction relationship and how a particular rasa will overcome the effect of virya or how virya will overcome the effect of rasa, all this being discussed. So in case of cardamom, it's very clear, Yela, it is a Shita in virya, but it is still potent kafara because of its katurasa.
Thank you there, sir. That clears many of the doubts regarding cardamom. And it's also interesting that based on the rasa and virya mix, how the same medicine would act in a different way. And coming to the similar doubt regarding Psyllium Husk, many of the scientific journals say it is useful both in diarrhea and constipation. And it is also used as one of the remedies for irritable bowel syndrome. How Psyllium Husk acts and where to use it properly, sir?
Psyllium Husk, it is not going to give a very good or convincing effect in case of a diarrhea because it has a typical potency of absorbing the water. Just because of that condition, or that because of that quality, we cannot use to do a particular condition because there is atisara, there is a excessive sarana of the bodily fluids going out through the adhovaga. Then we cannot simply accept or anticipate that by giving this one that extra water will be absorbed by this. No, because once it is absorbs the extra water, becomes a swollen, and definitely this Psyllium Husk and all those things will cause sarana further, because the main indication of these things are bulk enhancers. They will increase the Purusha quantity. So that's the reason we use them. It may be even Masha, or it may be even Yava, or it may be even Psyllium Husk. So this is very clear that it should be used in constipation in order to smoothen the movement, because it becomes a lubricative type of thing. It is ready to slide on the colon surface. So that's the reason we use it. But it is not a right type of thing to be used in case of a particularly, that Adhisara type of conditions. That may not be helpful. But only is that it has a soothing effect and it can act on the surface of the colon. Definitely, it can be used even in IBS type of irritable bowel syndrome and such conditions. But still, it is a drug of choice, particularly for the constipated things where Rukshita is there and where Vata is more dominant. In that conditions, if you can use it with soaked one, or even with along with a lot of plenty of water, then definitely it is going to help us.
Yeah, thank you there, sir. So the conclusion is more useful in constipation rather than in diarrhea. And same with the chia seeds. So this is where Western ingredients and when they are used in Ayurveda treatment, how it goes. So a lot of questions will come because we have some Western practitioners also participating in this. So the question is, some Vaidyas think chia seeds are Srotas Avaroda channel blocking. Not sure exactly what's the thought process behind this being a channel blocker. What are your thoughts? And what are the benefits of chia seeds, and in which conditions can it be included in Ayurvedic treatment diet protocol?
Even though chia seeds definitely it is not from the Indian continent and it's originated from the Latin America, and these chia seeds behave in a typical manner how an Indian plant like it's called as holy basil. That's one variety, or sweet basil. That seeds also behave in the same fashion. It's called in very typically in Hindi as a sabji beej, or in Kannada it's called as a kamakasturi bija. So these particularly sabji beej or kamakasturi bija, it's also called as one of the very famous faluda ingredient. It is very clearly when you put it to water, it's soaked, and that after soaking it swells in such a form that it absorbs almost 5 to 6 times or even up to 10 times of its weight. Such much of water it can absorb, and it becomes slimy. Almost chia seeds, even though it is not from Indian continent, but it's from the Latin American thing, but it behaves exactly like the holy basil, sweet basil. So it's better if you observe that, even try to analyze its amshamsha kalpana and try to understand its effect on the body. Similarly, with these drugs which are explained in Ayurveda, we come to a conclusion that chia seeds also behaves in the same fashion. It becomes a sara after soaking, and when it is consumed, it is instead of causing a channel blocking, it improves the movement. So it is be more saraguna yukta. So the saraguna will always help in sliding type of effect. So it is not going to harm or block the srotasas anyway.
So in line with your description that it is Sara and probably Vata and Lomana, that's why it's useful in bone health and sugar control, inflammation, heart health, skin benefits, and antioxidant effects has been attributed. So probably Vatahara is safe to say, sir?
No, it is containing more fibers. It's comparatively guru also. But once it becomes soaked, it becomes even sara. So any drug which is guru and sara in nature and shita in nature, definitely to try to remove the mala from the adobhaga. So definitely that type of it's colon cleansing, and it is definitely going to help in that way. And when vata anulomana takes place properly, then there will be very good effect on the pakwasha and those areas. So it won't cause you any trouble, or it won't allow to happen any painful conditions or something like that. So it is definitely it's Vatahara in nature because of its Guru Guna and as well as its Saraguna. So it helps in facilitate the functions of Vata. Chalatva will not be hampered with this. So that's the reason this. And it contains, of course, it contains quercetin and such other things. Definitely it helps as an antioxidant, but doesn't mean that it is an antioxidant. You go on eating these things, then definitely it will going to cause some problems because of its Saraguna. So that should not be. It should be taken in a limited quantity and particular season. It is better. So it can be even taken as a powder, and it can be even soaked and taken. It can be used as a Vatahara, but there are plenty of other important drugs which can be used as Vatahara. This is one of the drug where if a requirement, as particularly in case of constipation and those type of things, you can use it, even the chia seeds. As a routine protein supplement or something which is containing more fiber, such type of thinking with that line, if you are eating, consuming this, so you can definitely consume in the powder form, not as a soaked one. But still, it is comparatively guru in nature, sara in nature, and it has having a beneficial effect on the colon.
Let me bring in Dr. Raghuram sir to the scene, because this is one of the questions which are asked very repeatedly by many of the clients. Raghuram sir, can you explain to me how this Ayurvedic formulation will bring me to balance? Or what do you know about my dosha balance, and how are you going to treat it? So this is a classical case in some Western countries, that they somehow see this Ayurveda and dosha and balance, and they think that dosha balance is health and imbalance is unhealth. And many of the patients who approach doctors need not come for treatment for specific disease. They come to just for analysis of the doshas, or to get pulse diagnosis done. So many other allied health issues they may present. So if someone asks this, how do you approach? Please, Raghuram sir.
Is it a specific question or a general question related to some, like Ayurvedic herb formulation has been mentioned here?
It was asked in the group. So let's assume that, for any disease, you give any medicine and they ask this.
Since I don't know the pre-context of this particular question, if you can just ease in the question for me, I'll be able to answer that.
Okay, so let's assume that, this patient comes with cough and you give some medicines. You say Salisati Churna, and they start asking like, how do you know this balances my doshas in the chest? And how do you know what is my original dosha, and how are you going to bring me back to my original dosha level from this anomaly, for example?
Okay, so there is a lot of confusion regarding this dosha Prakriti and also dosha Vikriti. So generally what happens in the clinical practice is the newer Vaidyas, so those who don't have experience, so they also will be confused regarding what exactly is the Prakriti, what is Vikriti. So in the clinical diagnosis, while analyzing the patient, while taking the case history, while taking the symptoms or whatever, so it will be probably read as Prakriti. See, now many hospitals and also many clinics, doctors provide the dosha Prakriti analysis as a part of a complement or as a part of a clinical examination. So that will be done. So Prakriti, what is the memory of the patient? So if the person has come as a healthy person, so Ayurveda believes in Swasthasya Urjaskaram and also Arthasya Roganam. So two principles, basic principles is treating the diseases and also the balancing the disease in an already healthy individual. Now different clients approach to the clinics, to different doctors. Different doctors handle the pathologies in different ways. Now whatever the person is telling, now for example, we will take that a obese person has come into my clinic. So generally the thought process will go towards the Medavruddhi and also the other dhatu imbalances, and again we will go to the Kapha Varga. So because Meda or the fat belongs to the Kapha Varga, so we will think about the Kapha Varga. So all our indications will be there. The question is that the physician here, is he analyzing that the obesity or the gain in weight or the gain in fat or the bad fat in the system of the person is at present, or has it been a process, or is it right from the beginning, like right from the childhood? So there are some patients who tell that we were painfully thin. So that's the word which patients use, and we have become obese or gained weight over a period of last 6 to 7 years. Please help us out. So here the confusion to the doctors is seeing the obese patient and considering probably the weight gaining tendency would be there in the Kapha Prakriti person. So it might not be in the Vata or Pitta person. So here when we take the Prakriti, the Prakriti of the person was something else. It might be Vata Pitta or Pitta Vata or something else. But the lifestyle and the different situations and also the different factors which has influenced over the Prakriti of the person has led to the Vikriti. has led to the Vikriti. Just like we consider water body as Prakriti, a serene flow of water as Prakriti. So when there is a disturbance in it, so we get a tsunami. So that will be considered as a Vikriti. Okay, so when you see a tsunami, grading it as a bad water, so water always misbehaves and troubles us, is wrong, because we haven't seen the serene part of the water. So similarly, we haven't seen the serene part of the fire. Fire is useful for many good purposes, and also it can be very destructive, as in the case of volcano or something, the bigger explosions of the nature. So it may be in the case of tornadoes and other things where wind can be said to be very bad, or having a bad or the destructive effect, because we haven't seen the serene part of that. So in the clinical practice, for me, is for the Vaidyas to differentiate between what is Prakriti and what is Vikriti. For that, the case recording should start right from the beginning of their birth. What I do in my clinical practice is I ask the patients to send, like if I have a 50-year-old patient, I ask the patient to send the photographs at different decades, and also a childhood photo if possible. I will try to record the child, that is the birth weight of the individual. Many people will tell, sir, we don't know the birth weight, so because I'm 50 years old, my mother, father, who are the primary people who have noted my weight, aren't existing, so we don't know those things. So here some assumptions will come into the play. So like, what was the body frame and how it has been converted. Okay, so here very important is to analyze what is Prakriti. The patient or the person entering into our clinic has come with a Prakriti or a Vikriti. So while analyzing the Prakriti, the basic nature of the constitution or the body type of a person, we should not be confused and misguided so as to name it as a Vikriti or name Vikriti as a Prakriti. So while recording the Prakriti, one should be very, very, very careful so as to see that what were. So while recording Vikriti, it is very important to see what are. So this difference between were and are will differentiate between the Prakriti and Vikriti, and also the pathway, the passage, the journey taken by that particular person, what changes have come. And then after that, the etiological factors come into the question, the Nidanas. So if the person was painfully thin for 30 years, what happened after the third decade? So is it the physical problems or the physical factors which have contributed? Is it the mental factors which has contributed? Is it the stress or emotional factors which have been contributed? So what, or is it a collective contribution so as to cause imbalance? So the question was about the imbalance. So what exactly caused the imbalance? So here is the role of the Nidanas and Nidana Parivarjana. If we can track those, if for example the person becoming obese, I had a patient from Mumbai long back, so the person was very obese, so that he could relate the cause to bullying. The child was bullied at the school and the college level, and that led to depression and also mental imbalance. The person ate indiscriminately and gained weight. That is what he was telling. So he was more than 105, 110 kilograms. When I saw the childhood photograph of that person, so I got the patient at around 30 years of age, and the gain in weight for the last 15 years. The childhood photo or the adolescent photo was totally different. I could not differentiate between those two characters. They were just like two different characters, totally coming from two different planets. So here is where the etiological factors, so here treating that particular condition, balancing here is not all about the dosha balance. As the question was tending towards the dosha balance, how I would identify, the patient may ask, see, if I get an obese person with the psychological factors involving in gain in weight, if I go on giving some udvartana or some treatment to reduce the weight, or manipulate him through the panchakarma measures and also some oral medications to reduce the weight, that's not going to work. So because here is a strong mental component. I always ask my patients, are you a body over mind person or a mind over body person? So what is strong in you? You manipulate your body with the mind strength, or you manipulate your mind with the physical strength. So these are two different categories of people. So as you said, Dr. Hebbar, so as you rightly said about the patient approaching with Kasa might come with the question, if you give Talisadi Churna, Sitopaladi Churna, Agastya Haritaki, whatever, so how do you know that my Kasa will be cured? Okay, so first of all, we will try to figure out, so that is where the Nidana Panchakas and all those things come, the Samprapti comes, the case history comes. So when we take the case history, we will be able to correlate to the Nidanas. So how many Nidanas do we have, which we can detach from the patient? How many seasonal factors are there, which we can detach from the patient? How many known and unknown diets are there, which are contributory to the cause of the cough? So here, just giving Talisadi Churna and Sitopaladi Churna doesn't work. A chronic smoker, if I give Sitopaladi or Talisadi Churna, okay, so Dr. Hebar is also well versed in the Vaishyaja Kalpana, so I'm not going to comment on that. Gururaja sir is there, very rich resource person for Dravyaguna. So here I am speaking from the Kaya Chikitsa perspective, that is the clinical perspective. So unless and otherwise we ask the person, or we pressurize the person, or we create an awareness in the mind of the person to keep away the smoking habits, nothing is going to happen in the person. Smoking is injurious to health and the OD, so the people read and keep smoking. So this becomes a pragna parada. The person knows, most people who are smoking know that smoking is injurious to health. If you don't give away that, if the patient, if the doctor doesn't record that particular aspect of the Nidana, whatever treatment is given totally fails. So here, I always keep telling my students, when you are investigating a case, when you're taking a case record, you should be a detective. I also tell my students to read Sherlock Holmes, Agatha Christie, and watch many investigative shows as doctors. So because what you are doing in your clinical practice is also an investigation. So the Roga Pariksha and the Rogi Pariksha will, and a constant practice and also a big experience which we carry, will give us the confidence to find out, yes, at the beginning of the clinical practice it may be difficult, but when we slowly carry that experience, so we will try to find out with a short history also. So that is why the students have a OPD case and they're trained with a IP case. So OP case is a short case, how to take case history in short and prescribe some medications. IP is for chronic cases or the cases which cannot be handled at OPD level. So they are admitted in the IP. A detailed case is required to analyze. So this is all about the Roga Pariksha and the Rogi Pariksha and the methodologies used in investigating the case, and also differentiating between the Prakriti and Vikriti, identifying the disease, and then comes the Vikalpa Samprapti. If I'm taking long time, Dr. Eber, I would like to conclude here. So we will come to the Vikalpa Samprapti, where every fraction of the disease is understood, bifurcated, dissected. It's a surgical process where we try. Vata, the person is having dry cough. Yes, Vata may be involved. Okay, which part of Vata is involved in causing the Kasa? Okay, which Vata is involved? Whether it is Prana, whether it is Udana, or is there a Avarana? So, or there is a chronic case which belongs to the lower GAT, which is causing some pressure. So, like a constipation consistently causing a pressure over the chest region can also produce cough. So, Gururaja sir rightly mentioned about those drugs about which the question was there, how the Sramsana and other things will happen, how the Saraguna will help, and also how it doesn't hamper the Chalaguna. So this minute understanding of the disease process, the patient as a whole, so the comprehensive understanding of the problem, going into the depth of the investigation, and fractional analysis. I want to repeat this word. Fractional analysis of a condition will help a physician to diagnose a given condition and to select an appropriate medicine. Having said that, I too have 23 years of clinical practice. Many times the first prescription may not be the best prescription. So because presentations of the conditions, the presentation of the cases, the diseases are so much vivid and so much different in nature. If I have 10 patients of Prameha, I cannot give the same medications to all those patients. So here Ayurveda plugs in with the personal approach. We have a Samanya Chikitsa Siddhanta and also Vishishta Chikitsa Siddhanta. So a generalized line of treatment and a person-specific line of treatment. We call it as a personalized treatment approach. Okay, so there is P4 medicine. We will speak about that at some time. So I think I don't know whether I have addressed that particular question or I have encroached it or I have given irrelevant information. So, but as a clinician, I just wanted to tell. So the thorough understanding of a disease process is a big investigation, just like on the lines of Sherlock Holmes.
Over to you, Gururaja sir. You had taught us when we were in second year BMS and Yoga Vijnana and Vikriti Vijnana, there if somebody asks some question regarding like how the medicine acts or which particular pathophysiology it breaks or which samprapti it does Vigatana or so it's a case of like patients speaking Ayurvedic terms without much knowledge. So it becomes very difficult to handle such thing in a clinical setup where we are busy treating. So in one hand, we have to somehow answer the patient. There's another strategy which you were mentioning that, see, we have studied this for like 5.5 years and then EMD for another 3 years. There's a big pathophysiology there within the disease which cannot be explained. Which strategy to apply where?
So it's a very simple, maybe because of out of experience of so many years, I may say that, but for a newcomer it may be very difficult, but it can be done. So first thing is that when a patient approaches to a clinician, primary question from the clinician to the patient is whether he has come for a treatment of a disease or whether he wants to know his body nature, his prakriti or his doshic balance. Definitely he has come only for his doshic balance to understand or even prakriti to understand. Then instead of directly asking him, we may have our own questionnaire for that and we can give the printed questionnaire and ask him to fill it up. That will give us a lot of information regarding his desires, his intentions, his feelings and how he feels about this and certain things which cannot be understood or ruled out by personal examination. Such things he will give. Then comes our role as we can understand and we can observe his hair color, skin color, eye color and his texture and so many things. Then we can come to a conclusion that what may be his prakriti. When he has come only to analyze, get the analysis of the prakriti. But when he comes for a disease, definitely he will be pointing about the lakshanas, what he is suffering from and what is the problem he is facing with that. And definitely when such lakshanas are there are a certain understanding that each and every lakshana can be brought about by particular doshas. So if a person comes and tells that regarding there is a pain, usually vata is involved. If there is an itching, then usually kapha is involved. If there is a burning sensation, pitta is involved. Similarly, whenever there is a temperature, definitely there will be pitta is involved. So like that, we do a basic analysis and afterwards then we can try to understand that fractional analysis or amshamsha kalpana, what even Dr. Program has said, the same thing we'll understand, and once that is achieved, then we can go for a treatment aspect. So it's basically between the patient approach, whether he has come for the prakriti analysis or whether he has come for the purpose of the treatment. Then when he has come for the purpose of treatment, then definitely he will have certain lakshanas and he has quoted that I am suffering from these lakshanas. Then we made analysis, we understood certain pathology, proper thing, and then we given certain medications, the herbs. When these herbs are given, definitely with a span of 3 days or 7 days or 10 days, the what lakshanas he was facing or is troubling to him have been nullified, been reduced. That itself suggests that where dosha has been balanced. If once the nidana removed, nidana parivarjana has taken place and samprapti vigatana has taken place, definitely the things will settle down and doshas will come to normality. Once there is a balance of doshas, definitely there will not be any pathological symptoms in his body. The patient will not to feel any of the things which may say it is normal. So everything becomes normal. So that is the one understanding that we can understand when the doshas have become normal.
Yeah, one thing, Dr. Hebbar, I would like to add here is Dr. Gurubodha sir also was pointing towards this. So we need to stress upon this point. So dosha pratyanika and vyadhi pratyanika and ubhaya pratyanika chikitsa. So like dosha specific, this is the easier form of practice. Like identify the dosha. So as Gurubodha sir said, whether it is rise in temperature or burning sensation, correlate it with pitta and try some pitta relieving remedy. So this is what the beginners start with. So like, and then we have a vyadhi pratyanika chikitsa, so like disease specific treatments. So those have to be implemented at the, to understand this, where dosha pratyanika chikitsa and where vyadhi pratyanika chikitsa should be given. And generally Vyadhi Pratinika will also be Dosha Pratinika, and sometimes Dosha Pratinika also will be Vyadhi Pratinika. So if I am using the Ayurvedic words too much, so it is dosha specific or disease specific or specific, that is generalized treatment where a treatment or a therapy or a diet or medicine is suitable for both disease and dosha. Some may act in both ways. To understand this particular aspect, we need to understand the 6 stages of the disease explained by Master Sushruta, that is the Shatkriya Kala. So the initial phase of the disease where the doshas are manifesting themselves, like in Sanchaya, Prakopa and Prasara stages. So probably our dosha Pratinika will work to an extent, and also the seasonal remedies will work there. So because Sanchaya and Prakopa, the accumulation of doshas in their place and in a small scale is Sanchaya. Accumulation of doshas in a larger scale is called as Prakopa, and then the tendency to flow out of their place and also to encroach to the other places is called as Prasara. In Sanchaya and Prakopa, generally it takes place in the seasonal, with seasonal variations, the variations with respect to the lifestyle, with diet and almost attitude, everything related to the seasons. So if Prakopa is not controlled only, then it will progress to the Prasara and the next stages of the disease. So there, the dosha specific remedies can be tried. Once the doshas get settled in the tissues and start bothering the tissues, from the 4th stage of the pathogenesis to the 6th stage, 4th and 5th, to be very precise, these 2 stages, that is Sthana Samshaya, wherein the tissues are touched upon, the doshas go and touch the, so just like the shunting of the 2 bogies of a train, there is a shunting, so just they go and disturb. And in the last, that is in the 5th stage, that is the Vyakta or Vyaktivava stage, there is a larger disturbance and damage to the cells to a smaller extent. And the last stage, again, doesn't belong to most of us because it is a complicated stage, Vedavastha. In the 4th and 5th stage, the Vyadhi Pratinika Chikitsa or the disease-specific treatment will be applicable. To understand which type of treatment should be given, whether herbs should be given or the formulation should be given, or only in Sanchaya and Prakopa stages, in the first 2 stages of the disease. Most of the times it is very important to follow the seasonal regimen, that's it. If you follow the seasonal regimen, things will come under control. So that is why Vagbata also has mentioned Sanchaya, Prakopa, and then suddenly taper, Prashama. So there the immunity of the person and also many other factors will come into the play. So where the dosha which has gone naturally, in all of us it takes place. A small accumulation, a small aggravation, and an immediate taper. If it doesn't taper, then it may progress to the next stages as mentioned by Sushruta. So this is one thing I wanted to tell about the choice of which, so the dosha pratanika and the Vyadhi Pratanika Chikitsa. So this comes with experience. So we try to find out where exactly the disease stage is. And last point I would like to add is, it is not all about the doshas. So there is a definition of swasthya or swastha in Ayurveda. So there should be a balance of dosha, balance of the dhatus, that is tissues, the balance of the malas, say proper and timely excretion of the unwanted things, and then prasanna atma indriya manaha. So a balance of almost the other faculties other than the physical faculties, like the mind, the senses, and also what we call it as the soul, everything, all these come into the game. So when all these things, so if we need to satisfy the definition of health, none of us will fall into that particular category of the definition of swastha, because all those things should be satisfied. So this is one thing I want to try. Thank you.
So Dr. Shiva Yasan, she is doing PhD in Bicycalpana. She wanted to add something.
Thank you, sir. Actually, there was a confusion like how to assess Prakriti when the person goes to us Vikriti. This was actually a very common question that we used to have as students. I have learned a technique, simple technique that my guru, Dr. Prasanna Venkatesh sir, taught me when I was studying, when I was actually working with him in his clinic. So he used to tell a technique which I also found it very practical, that whenever a person comes to us, always will come with a disease. So it is very difficult to analyze the Prakriti. He used to say, you can see his palms. So when you see his palms, the structure and the features usually suggest, we can easily define to which Prakriti he belongs. If they are very slender, long, it will be usually of Vata Prakriti, or if they are very fat or very structured and it is plumpy, then it will be usually of Kapha Prakriti, because the palms or the soles usually they won't change. Even in the conditions of obesity, there may be fat accumulation in the whole body, but the palms remain the same. Even same thing is true with the facial features, structure of the nose. So all those, the facial features too remain the same even in many conditions of the Vikriti.
There are a lot of questions coming in here. What is the line of treatment in autoimmune thyroiditis, high ATPO but normal thyroid hormones, Agni, Svishama, and sometimes Tikshna? How do you please go ahead? Just a general approach would be helpful, sir.
See, definitely when a condition has been diagnosed from the other set of field, that is allopathic field, so as autoimmune thyroiditis, definitely will have issues related with the hormone. And if it is an autoimmune component is disturbed, definitely there will be difficulty in treating the conditions. And definitely when there is an autoimmune conditions are there, these type of diseases fall under the category of either Yapya or Asadhya type of diseases in Ayurveda. This type of autoimmune thyroiditis and conditions, but the drugs almost remain the same. Even though it may be a simple thyroid issues, maybe Graves' disease, or even autoimmune thyroiditis, or even Hashimoto thyroiditis, whatever it may be, but when all these comes, definitely the role of physician anywhere across any of the therapies, I mean pathies, it is very difficult to manage these things. And of course, the important treating here is always something like maintaining the Agni here. So we need to maintain the Agni, then accordingly these things will settle down. And definitely when we are using these type of conditions, I mean treating these type of conditions, definitely we have given at our disposal only few formulations. Otherwise we need to mix the combination of our own and use it whatever available to our places nearly. So otherwise, generally what we can do is only using Rasayanas and Agni Vardhaka Dravyas can be used.
Thank you there, sir. Moving on to the next one. What is an effective or topical application or kashayam, etc. for 70-year-old women with Vatarakta complaining of painful, sensitive feet? So diagnosis was made as Vatarakta having painful, sensitive feet. She just began with internal herbal formula, however, would like to have quick pain relief. Gurubodha sir, please, can you please decipher?
So definitely for this, you can go for Guduchari Taila, topical application, if it is a confirmed case of Vatarakta. Otherwise, you can even go for the Kashaya Dhara. It will be lukewarm Kashaya Dhara, that will going to definitely help her. And of course, Guduchari Kashaya and something like that, which internally may be already given. I mean, already giving in that conditions. Definitely, of course, Ma Manjistadi Kashaya and Kaishora Gugudu are the best combination. You can use all those things and definitely it will give relief. But it takes time. It is not easy that with a very instance or a first chance itself, the patient will going to get the relief. It may take few sittings or it may take few days to show its effect.
Sir, especially with like disease like Vatarakta, etc., where medicine list has been like very well established, and Asangridya gives Kaishar Gugulu, Guduchadi Kashayam, lot of Guduchi options they have. Master Acharya Vagbutta has given, Shirgula Taila, etc. So it's pretty much easy to follow when we read the Samhitas and follow, especially when the diagnosis is already made, sir.
If you could able to correlate that what the condition been explained in the modern medicine as gout or something like that, which almost correlates with Vatarakta of Ayurveda. And of course, the total boundary of Vatarakta is comparatively bigger than what the gouty arthritis is. But most of its symptoms fall under this category. So we can treat all those conditions based on the Vata, Rakta, Hara type of diseases, where we are targeting particularly on the Vata as well as Rakta Vashrotas. These two things we are taking into consideration and we are using the medications. And of course, Guduchi is the one drug of choice and the best drug because it is Vatarakta Hara by Prabhava. Any drug which shows an action due to Prabhava will always be a better type of action. So Vatarakta Hara action of Guduchi is comparably a very high standard action, pharmacological action. So it is better to use Guduchi in different modalities, maybe in the form of Bala Guduchadi Kashaya, or Guduchadi Kashaya, or even Mahamanjistadi Kashaya, as well as even Guduchadi Taila, external application, all those things can be done.
And staying with the Vatarakta to Raghuram sir, please explain in brief in 5 minutes about Panchakarma and Vatarakta, your experience and what is there in Kai Chikitsa. So what can you tell about it, please?
Panchakarma in Vatarakta, so always Vasti will be the best one. So again, if you're a Panchakarma practitioner, you should have all the setup of Panchakarma, and you should be preparing your own medications, and you should have very good, like Chikitsa Chatushpada, everything, especially the Paricharakas, the attendants or the masseurs or whoever, the helping hand should be really good. So the medicine should be available at hand. So Vasti will be the best one. Rakta Mokshana, yes, many people are not practicing. Even I am not practicing Rakta Mokshana because of the limitations of. So it can be done at the hospital level. So at clinical level, so yes, as Guruji sir said, we'll go with. There are many options of kashayams or the grutas, or I would like to add Pindathaila also, since patient is having the burning sensation and also the burning foot, and the 70 years old a patient. So we can go with Pindathaila also, apart from Buluchadi Taila, which is a fantastic recommendation by Dr. Gurubodha sir. Again, Kokilaksham Kashayam would fall into so regular intake. So because I did not know this, while discussing with some Keralites, I came to know Kokilaksham Kashayam. So there is an indication that the person can take Kokilaksham Kashayam till the anger comes down. Gurubodha sir and Dr. Hebbar may correct me if I'm wrong. Till the anger comes down. So that means to tell that the person's anger will never come down throughout the life. The anger is a part of us. That means to tell that the indirect indication is Kokilaksham Kashayam can be taken for lifelong, and it doesn't have side effects also. So since it is an aged patient, Kokilaksham Kashayam in small doses every day, I think should work wonders apart along with Pindathaila. And coming to the Panchakarma, yes, Vasti, fantastic results it will give. So we can even go for Kshiravastis, especially the Dashamula Kshiravasti, fantastic results in Vatarakta. So again, Guduchi Kashaya Basti or the Kshiravasti will be fantastic. One should not forget, whenever we are speaking about Vatarakta, Guduchi Tinospora Cardifale is the golden choice, always golden standard. So any formulations having Guduchi and these things, I think should work out. Again, the Uttana Vatarakta or the Gambhira Vatarakta, the chronicity of the disease, when it was diagnosed, it is acute or acute on chronic or chronic, everything will depend on the results. And especially the aged patient, we need to see if the Vatarakta, if it has been diagnosed as Vatarakta since many years, the patient will still be Yapya Asadhya. We can only try to relieve the symptoms So we cannot assure, we'll try to relieve as much as possible. And of course, aged patient, Rasayanas are a must. Will go with some Rasayana. Again, something which is comprising of Guduchi or I think Dr. Hebbar or Gurubodha sir will be good enough to suggest some ideal Rasayanas. So this is about the Panchakarma. So Virechana, yes, in some cases, when you cannot practice Vasti, so probably a Nitya Virechana. So something having, even Avipatikara has eased the symptoms of Vatarakta in many cases, along with the Vyadihara Chikitsa, specifically using Guduchi and other things, Kokilaksha, etc., some external applications, Kaishora Gugulu, yes, absolutely a good one. Apart from these things, some Rasayanas and also some Nitya Virechana. So like Nimbamruta, the Erend Tela also has worked in some of my cases. So because we know the composition of Nimbamruta, the Erend Tela, Dr. Hebbar can share the link. So that also has worked good. So as Nitya Virechana, small doses, relieve the symptoms, ease in the pain and related symptoms. Again, what we need to look, whether it is acute and chronic, is there exacerbation and other things. So very regular Panchakarma therapies, at least once in a year, is very, very mandatory for chronic cases of Vatarakta to keep the disease under control. So, and very important is to have the follow-up, a proper follow-up, very, very religious approach towards the diet, and a customized diet and the personalized diet by your physician, and also some medications which are very useful, and of course continued Rasayana, and at least periodic Vasti once in a year will be good. If the pain or any other symptoms are very frequent on and off, just go with some applications like Lepas and also the Thailas and other things. So we can discuss that whenever time permits. So I think this much information is sufficient from my end.
Yes, between Gurubodha sir and Raghuram sir, they have covered like in 10 minutes the entire Ashtanga Hridayas Vatarakta Chikitsa. So thank you very much there. Even in like Dashamalak Kshirabasti is there, and to add one more, Yashtimadu Kshirabasti and Yashtimadu Taila is also another option given
Absolutely.
in Ashtanga Hridayam. So to the last question, this is to Gururaja sir. Manasamitra Vatakam, we agreed in one of the previous sessions that it's not a medicine which can be used very frequently, and there should be some care to be taken while it is to be used. For example, it cannot be used as frequently as Brahmi context. Can Manasamitra Vatakam be addictive in patients? And there was a case where the patient itself was demanding for these medicines. So there are two aspects. So I mean, just because patient is demanding, probably it's not addictive, probably it was effective. Please decipher it, Gururaja sir.
See, try to understand this. Manasamitra Vataka is such a type of medicine being prescribed by a doctor to a patient who has an issues with manas. Maybe cognitive functions, maybe learning abilities, maybe decision making, maybe overcoming the addictions or whatever it is. So he has some problem with the manas. Only in this type of condition, usually doctor prescribe Manasamitra Vataka. And Manasamitra Vataka do contain the herbo-mineral part of it. So whenever there is a mineral part of it, you cannot continuously simply as an herbal medicine, you cannot take it continuously. The line, we need to stop it. But basically what happens is Manasamitra Vataka, when it is given to such patients, they'll consume it and they'll find relief. And they have weakness in their mind that they need something to be as in supporting the mechanism. So if they are taking some other medicines, then we've asked them to stop it and use these medicines. Then find it relief. They will try to depend on this. They don't want to stay independently without any medications. So in these type of patients, it is better to give a counseling part more of thing rather than prescribing a medicines. Repeated counseling is required, and along with that medication, to some extent, it will be good. But in any way, Manasamitra Vataka doesn't have the capacity or ability to cause an addiction. This addiction, if it is anybody, any person who is asking for that, he needs to continue with that, just maybe because of the good effect of the drug, or he is having a tendency to depend on something, some or the other things. If you just skip over from Manasamitra Vataka to some other drug, then he will stick on to that drug because he needs that drug. Without that drug, he feels that I am not complete, I will not be normal. So because of those reasons, that the tendency or such type of questions arises. Otherwise, the Manasamitra Vataka doesn't have any such type of narcotic drugs or anything that which can cause an effect of addiction.
I've seen this with like chronic constipation and chronic depression and chronic anxiety people. Both of them have a tendency to develop some kind of dependency, though the medicine itself is not addictive because of their inner pathophysiology. They try to become addictive. Probably it's a good idea to like cycle the medicines, like change for example, constipation, change it once in 2 months so that patient doesn't become addictive. Is that a good strategy, sir?
It's only just we are trying to play with the mind of the patient. Medicine doesn't have such type of dependency. Here, that is the person is taking this medicine probably because of the good effect of the medicine. He don't want to lose that condition. If I say that anyhow you are completely normal, now why you want to take this medicine? Let me stop this medicine. Then he will say, sir, let it be for this month. Let it be next month, and I'll come and then we can take a decision. So when next come with answer, I am fine now. Let it be like this, sir. So he don't want to leave that. Then you just take a decision that okay, you are now fine. Your doshas are good. Let me reduce the strength of the drug. You change the drug to some other one slowly. Then he will stick on to that one. Like that, we need to prescribe in many occasions. That doesn't mean that the drug has a dependency, but it is a mentality of the person or the patient who develops a dependency on whatever you give it. Any medicine, if you try to give them Avipatikara also, he will develop a dependency on Avipatikara Churna also. Doesn't mean a Manasamitra Vataka.
Last question of the day.
I wanted to understand more deeply than in Charaka, in mental health, Charakaji is explaining that one of the methods to balance mental health is dharya, is the behavioral principles. And then he explains again Dhriti, Smriti and Samadhi. I understand the Samadhi and understand the Smriti of gaining the wholeness of memory. But Dhriti in this context, is it more like maintaining the Samadhi in order to be free from distortions of intellect? Because you have to maintain it in order to be free from mistake of intellect and have the full memory of the wholeness. Or Dhriti is meant here more like control of negative thoughts, so that you are not dwelling in a past, like in depression. Could you give some light to that we could interpret, Charaka?
One who has a sound mind will definitely have a good Dhriti, Smriti as well as Dhriti. See, the Dhriti Smriti, why has been explained as one of the important factors is that we need to understand, or the patient needs to understand what exactly the truth is. So for any given condition, we try to educate the patient in such a way that, see, this is the truth. What you are feeling or what you are observing or what you are considering itself as a truth, that is not the real truth. That is a false notion. You just come out of that. This is the truth. This is what Acharya has said. Like this, we need to educate them on many occasions. Attaining Samadhi is only one type of thing that cannot be achieved by each and everybody. That is very highly tough task. Second thing, negative vibes and all those things. This doesn't come under the area of Samadhi and all those things. It comes once again very typically Dhriti. What exactly the stating and what exactly the normalcy, what exactly the truth that we need to understand, and we need to keep it for a longer time. When that is kept in your mind, at the time required, then it can be recalled. So when these things happen normally, then definitely the mind health or the mental health will be definitely a good one. When you could able to understand this, of course it's fine. Then comes the very higher stage of thing, Samadhi. This is leaving everything of this world and going something beyond that for a time being, maybe for a short duration or maybe for a long duration. That requires a very, very big task, and that cannot be possible in a level of patient counseling or OPD or something in IPD levels. It is not possible. It is personal understanding and the personal enlightenment that he needs to go in this direction, then he can go for the Samadhi. So Samadhi cannot be taught by anybody. I cannot just give a prescription that you need to go for a Samadhi for some time. No, it is not possible. So we can suggest him to understand what is the truth. Dhi can be enhanced, Dhriti can be enhanced, and Smriti can be enhanced by various methodologies and practices, and as well as supporting some Medya Rasayanas. Attaining a Samadhi or going to that level or separating for a temporarily for all these things from this world, that cannot be from the patient. It is even difficult for even the doctors to achieve that. It requires a lot of efforts.
Could you explain one more time that Dhriti, just the meaning of Dhriti is more like restraint from the behavioral habits, or it's more like a psychological counseling towards the more of the truths of life, or the Dhriti?
See, there are three important factors: Dhi, Dhriti, and Smriti. Dhi is the natural intellect or the person's mind or a capacity or intellectual in that he could be able to understand what I am telling. Dhriti is the process of learning, understanding it. And Smriti is holding it for a long time, and then when it is required, it is being recalled. So any information which is truth, understanding it, studying it, holding it for a long, or even you want to study anything, you require the that intellectual quotient or intellectual property you should have in the inbuilt, so that you can read and understand. Dhriti will definitely try to maintain that information in your brain, and Smriti helps to recall it whenever it is required.
Thank you. This was very, very helpful. Thank you so much.